Hi guys. I got a couple of requests for a topic called as premature ovarian failure or premature menopause, or also called as premature ovarian insufficiency. Now, ideally speaking, the uterus and the two ovaries work in synchrony with the brain and the hormones. Every month, there's a process called as ovulation, where an egg is released from the ovary, which can be, if required, impregnated by the sperm into the uterine cavity, forming an embryo. Now, what actually happens? This process is allowed to occur till the woman is having her reproductive life, which is from the first day she gets her periods, from menarche up to the time of menopause, which lasts up to 45 to 50 in majority of women in India by the race. Now, if menopause occurs early, or if a woman is not getting her periods since the age of 39-40, this is called as premature ovarian failure. So the failure of ovulation before the age of 40, or the failure to get pregnant before the age of 40, if a woman is actively trying, is called as premature ovarian failure. Now, it's simply because of the hormone imbalance. Now, usually the brain secretes hormones that go from the pituitary gland up to the ovaries, and they help in production of the hormones progesterone and estrogen. Now, for that you require follicles, you require eggs in the ovary. Now, the hormones on the brains go to the ovary and they knock on the ovary to produce the hormones progesterone and estrogen. If the hormones on the brains have risen very high and there's no response, this is the typical case of premature ovarian failure, which is hyper hormones but no ovulation. So in scientific terms, it's called as hypergonadotrophic hypogonadism. The ovaries have gotten smaller because the number of eggs, follicles in them, have drastically reduced. Now, the actual cause for this is still not known. No one knows why this happens. But there are various causes. There are chromosomal causes, autoimmune causes, women who have been exposed to any radiation, chemotherapy, immunotherapy. There are various causes. Investigating such a patient is usually of not of much use. You can find out the cause, but there's no actual treatment for this. So women end up going for procedures like IVF, they go for donor egg, in which an egg is taken from another woman and the husband's sperm is used to impregnate the egg, and that embryo is deposited into the lady's uterus. So this is called as donor egg, donor IVF. So if fertility is the concern, then ideally speaking, these are the only remedies of IVF, the donor egg. Now, if a woman has completed a family and she's getting these symptoms, there's nothing much to worry. She has to just take medication and precautions for the symptoms of menopause and work accordingly. Hence, I always urge all the patients once they cross 30, 31, 32 to do an AMH. AMH is the blood test that gives you the egg count, the egg quantity and quality, which is a sign of ovarian reserve. But doing an AMH, you will know exactly where you stand. If your AMH is low at the age of 31, 32, you know you don't have much time. If your AMH is good by then, you can even freeze your eggs if you're not planning childbearing anytime soon. So just a few precautions. This topic is very vast. It's actually a very scientific topic. Compared to my previous videos, if you see, which are mostly on symptoms and signs commonly seen in gynec conditions and pregnancy conditions, this video is more to do with the condition which is mostly of investigation and research. Anyways guys, I hope this video fulfills the request of the people who asked me for it, and please share the video, and if you like the page, please like it and hit the subscribe button. Thank you. Good day.